Hi everyone and welcome to our ECG course from zero to hero in acute coronary syndrome. This is Hisham Ibrahim. I'm one of the emergency medicine consultants in United Kingdom, and in this talk we're going to be talking about some indications to activate the cath lab and when to do it appropriately and when it's going to be considered a little bit of an inappropriate indication to do that. So let's move on and see what we can come up with in this talk. And that was the second case. And now we're going to move on to our third and last case. And this time it's going to be about a 69-year-old male patient presented to ED with a history of chest pain. The ECG, when the pain was there, showed ST elevation MI pre-hospitally. So the ambulance crew gave some medical treatment and immediately transferred the patient to your hospital. On arrival to the emergency department, the patient became pain-free and the ECG was repeated and it showed no ST elevation at all. So now we are dealing with a patient who's pain-free with a normal ECG. The question is, would this patient qualify for immediate PCI in your local hospital now, knowing that the patient not long ago has had chest pain with ST elevation? This is the question that you'll need to think about. This is the case that we're going to discuss. We're going to discuss PCI for transient ST elevation patients. So, back again to the European Society of Cardiology 2020 guidelines for management of ACS in patients without persistent ST elevation. And let's see what they recommended. They said that in patients with transient ST elevation and relief of symptoms, an immediate invasive strategy did not reduce the cardiac mortality rate and or didn't reduce the infarct size compared to early invasive strategy. So there's no difference in the outcome when we compare immediate invasive strategy compared to early invasive strategy. And again, this is coming from the same guidelines. They found that an early invasive strategy within 24 hours is recommended in patients with any of the following high-risk criteria. One of them is transient ST elevation. And as we can see here, the level of evidence is green. So we've got a class 1 evidence, which is probably the highest level of evidence that you would be keen to see. That supports that you do not take transient ST elevation straight to the cath lab, and you take them to the cath lab within 24 hours rather than within 2 hours. So let's go back to our case and let's see what we should do. So this case was about a 69-year-old male patient presented to ED with a history of chest pain. The ECG, when the pain was there, showed a STEMI. Then on arrival to ED, patient became pain-free and the ECG improved to no ST elevation at all. The question was, do you think if you try to activate the cath lab immediately for this patient that you're going to get a yes? Well, the answer is no. Now we know that these patients, per the ESC guidelines, they do not qualify for immediate PCI and they qualify for PCI within 24 hours. And the reason behind this is that there is no evidence that immediate PCI will change the mortality or change the outcome here. So that was it regarding our third case and last case in this talk. What we need to cover at the moment is some more things that I'd like to cover before we finish this talk.